Hi, good day. I'm Rene H. Cape from SAS and Lipa City. And today I will be demonstrating NGT feeding. Prepare all materials needed for the procedure. Before we start the procedure, perform proper hand hygiene. Prop the patient to at least 30 degrees angle. Check the feeding tube placement. Ask the patient to open his mouth and check the back of the throat. This is to make sure that the tube is not coiled. Ensure the recommended external length of the feeding tube is measured and consistent during each feed. The feeding tube should be secured firmly to the nose and cheek with the tape. To check if the feeding tube is in the stomach, withdraw some gastric content with the syringe. If you are unable to obtain gastric content, lie the patient on their left side. Inject 10 to 20 ml of air into the tube and make another attempt to withdraw gastric content. Read gastric content pH level. If the pH level is below or equal to 5, he is ready to be fed. Please note that the pH levels can be affected by certain medication such as protein pump inhibitors, H2 antagonists, and antacids. If the patient is on other medication, please check with your doctor or pharmacist as they might also influence the pH results. Feeding of oral nutrition supplement. Check the feeding schedule. Prepare the correct amount of oral nutrition supplement prescribed. Prevent air entry into the stomach by kinking the feeding tube. Before connecting the syringe, flush the tube with 20 ml of water or as per prescribed. Feed according to the feeding schedule. Position the syringe slightly above the head. Ensure the syringe is not empty during feeding. This is to minimize stomach discomfort due to excessive air entry. Complete the feeding by flushing 20 ml of water or as per prescribed. Close the feeding port with the stopper. Feeding medication. Ensure right medication is being prepared. Crush the medication finely or dissolve the pills in lukewarm water. Connect the syringe without the plunger to the kinked feeding tube. Before feeding the medication, flush the feeding tube with 20 ml of water or as per prescribed. Pour the medication into the syringe. After administering the medication, remember to flush the feeding tube with 20 ml of water or as per prescribed. The patient should remain seated for at least 1 hour to prevent gastric reflux. Precautions. Do not mix medication with oral nutrition supplement. Administer feeds prescribed by your healthcare professional. Consult nutrition nurse specialist for other options that do not cause tube blockage. Use only water-filled syringe and apply pressure to plunger to flush and unblock the tube. If the feeding tube is accidentally removed, contact your healthcare provider.